Hi everybody, it's Dr. Ying Qi with Orange County Hand Surgery. Welcome to another episode of In Good Hands with Dr. Qi. Today we'll be talking about one of the most common tendonitis and wrist pain cause, Quervain tendonitis. Quervain tendonitis is one of the most common cause of wrist pain and wrist tendonitis. It is inflammation of the tendon that's in your wrist area, especially the one that's on the thumb side. Now, what is tendonitis? Well, tendon is a structure that connects your bone to the muscle. So when that structure gets inflamed, that's called tendonitis, and that causes pain and discomfort when you're trying to use your hand or wrist. So what are the symptoms of Quervain tendonitis? Usually people will feel pain and swelling mainly on the thumb side of the wrist. And it gets worse with repetitive use, and sometimes you can also feel a small lump in this area. So what causes Quervain tendonitis? Usually it's from repetitive motion. For example, if you're lifting a lot in this position, for example, I have a lot of patients that has Quervain tendonitis, they're dentists, so when they work, their wrists are in a bend position. Other patients, they are new moms, so they're lifting their baby quite a bit in this position. Occasionally, trauma can also cause Quervain tendonitis. For example, for patients who actually recently had a fall or wrist sprain, that can also cause inflammation right here. So mostly is repetitive motion, but sometimes can also be post-traumatic. So what to expect when you go see a hand surgeon for your Quervain tendonitis? First, we take an x-ray of your wrist. The reason we take an x-ray of your wrist is that sometimes people can have other causes of wrist pain that's not Quervain tendonitis, but mimics its symptom. For example, people can have arthritis in the basal joint of the thumb. They can have wrist sprain. Thus, they all can cause pain in this general area. Therefore, when we take an x-ray, then we'll know exactly what it is and what it is not. Next, I'll do a physical exam. There's a very particular exam that we do. It's called Finkelstein's test. Okay. So what we do is we ask you to make a fist with your thumb inside your fist, and then I will forcefully bend your wrist this way. For people with Quervain tendonitis, that causes a very sharp pain going up the wrist and going into the muscle. So that test puts the specific tendon on stretch, and that's a very, very classic finding. This concludes part 1 of Quervain tendonitis. Please make sure to join us for part 2 of Quervain tendonitis, where I'll be talking about the treatments.